Welcome to The Explainer. Today, we're diving into a crisis happening in our emergency rooms, but it's probably not the one you're thinking of. This isn't about a lack of resources, it's about character.
So, can a 2,000-year-old text really solve a modern medical crisis? Well, that's exactly what we're going to explore. This is a story about burnout, about making impossible choices, and about finding wisdom in a very, very unexpected place.
All right, let's get into it. Our story kicks off at, the worst possible time, 3:47 in the morning. We meet Dr. Purva, an ER resident who is smack in the middle of what she can only describe as a moral disaster. Here's what happened. An 87-year-old patient who had both end-stage dementia and metastatic cancer went into cardiac arrest. The team started what's called a code, a resuscitation attempt, but it just kept going for 40 minutes. The procedure was brutal. We're talking broken ribs, internal bleeding, all for a patient who realistically had zero chance of a meaningful recovery. Afterward, Dr. Purva just unloads on her mentor, Dr. S.B. She tells him that's not medicine, that's cruelty dressed up as heroism. And you can just feel her frustration, right? The attending physician simply refused to stop the code, driven by this ego-fueled need to never give up. The result? An exhausted team, a devastated family, and a furious Dr. Purva.
So how does Dr. SB respond? You'd probably expect him to pull out a medical textbook or quote some hospital protocol, but nope. He turns to something completely different, an ancient Hindu scripture called the Bhagavad Gita.
He introduces Dr. Purva to this core concept from the Gita. Now, the name is a mouthful, Divasara Sampad Vibhaga Yoga, but it's basically a framework for distinguishing between two fundamental ways of acting in the world. And get this, it was originally written for warriors on a battlefield, but as we're about to see, it's just as relevant for a doctor in a modern ER.
So let's break this down. On one side, you've got the divine qualities, things like compassion, truthfulness, and self-control. These are the qualities that lead to good outcomes. And on the other side, you have the demoniac qualities, arrogance, anger, ignorance, the stuff that, causes suffering for pretty much everyone involved.
And here is the core message right from the Gita. The divine qualities lead to liberation, the demoniac to bondage. What does that really mean? It means your inner character directly shapes your actions. The very same medical procedure can be an act of healing or an act of harm, and it all depends on the motivation behind it.
Now, this is where things get really fascinating. This ancient idea isn't just a philosophical discussion happening between two doctors. It's now being formally adopted into modern medical guidelines. This is literally changing the rules. For the first time ever, the 2025 guidelines for ACLS, that's Advanced Cardiovascular Life Support, which is basically the Bible for resuscitation, will now include a full, comprehensive chapter on ethics. This is a huge deal. It is nothing short of revolutionary. And this new ethical framework, it's built on 4 core principles. You have beneficence, do what's best for the patient. Nonmaleficence, do no harm. Autonomy, respect the patient's decisions. And justice, treat everyone fairly. If you look closely, these directly mirror those divine qualities we just talked about. Compassion, truthfulness, fairness, it's all right there. And this quote from the new guidelines really highlights the mandate. It says professionals should actively address structural inequities. This means the principle of justice isn't just a vague idea anymore. It's explicitly tied to equity, making it a core ethical obligation for doctors to fight disparities in healthcare. It's not an option. So how does this all work in the real world? Well, let's check back in with Dr. Purva, who gets a chance to put this new understanding to the test just 2 days later when she has to lead another critical code. This situation is grim. The patient is a 92-year-old woman, nonverbal, bedridden, and her arrest was unwitnessed. The team starts CPR, but after 15 minutes, nothing. No response. Dr. Purva knows she's facing a critical decision, so she pauses the resuscitation. And just listen to the shift here. Instead of acting from ego, she asks her team, I need input. Does anyone have concerns or suggestions? See that? She's leading with humility. She's inviting their perspectives. It is a complete reversal from that first code. Next, she goes to talk to the family, and when she hears them say they want everything done, she doesn't argue. She doesn't pull medical rank. Instead, she sits with them, and she practices what the new guidelines call shared decision-making. She speaks with such compassionate honesty. She tells them, I believe the kindest thing is to stop and let her go peacefully. And by doing that, she creates a safe space for the family to open up. They reveal that their mom never wanted to be kept alive this way. And so, guided by Dr. Purva, they make a decision that honors the patient's true wishes.
Dr. Purva's transformation, it shows us something really profound. Ethical practice isn't just about following rules written in a textbook. It is about actively cultivating your character.
So, how do you do that? The source suggests a path of daily self-reflection. You can think of it like a mental workout, asking yourself tough questions at the end of each day to strengthen those ethical muscles. Questions like, what really motivated my decisions today? Where did my ego get in the way? Which divine qualities did I manage to embody?
And what's really important is that the new guidelines recognize this isn't just on the individual. The hospitals and organizations themselves have a responsibility to create systems that actually support their staff when they're facing this kind of moral distress. And all of this brings us right back to the Gita's promise of liberation. In modern terms, you can think of it as freedom from burnout, moral distress, and ego-driven decision-making. And it's freedom for a truly patient-centered practice, a clear conscience, and a career in medicine that feels both meaningful and sustainable. Ultimately, this whole story from the ER raises a powerful question for all of us, no matter what we do. When the pressure's on, in those moments that truly define you, our character is what guides our actions. The choice between acting from a place of compassion or a place of ego, well, that's a choice we all face. So what will you choose?